So fever is when the body temperature is above what we would call normal. It actually depends a little bit on where you measure it and even with what you measure it and what time of day, but generally speaking, above 38 degrees is considered a fever. A fever is a sign that your child's immune system is working. In most cases, that's to fight off a simple infection, usually a virus, but there are some cases where it might be more serious, and there are things parents need to look out for that would be reasons to get their child seen by a doctor. At the Royal Children's Hospital, we see fevers all the time. 50% of preschool-aged children had had a fever in just the last 3 months alone. A lot of parents are a bit confused about the best way to respond to a fever if their child is experiencing one. In our study, we found that over 80% of parents believe that they need to lower their child's body temperature if they have a fever. This was usually because they're worried that the fever itself is harmful. In fact, that's not the case, and the types of things that parents are doing that we don't recommend include giving their child a cool bath or perhaps putting them in the shower, taking their clothes off to cool them down, or giving them medicines just to lower the body temperature. These things are not needed and in fact not recommended. So if your child is unwell and the body's under stress, it can actually be harmful to cool them down. Putting them in a cold bath in particular might cause more stress to the body, so it's much better to leave your child without that cooling process to actually stabilise their body temperature on their own. So the first thing to do is keep your child comfortable. That might mean pain relief if they're also experiencing pain or discomfort from whatever is causing their fever. They might have tonsillitis, it's causing a fever and a sore throat. It's a really good idea to give them some medication for that sore throat. It's also important to keep up their fluids. When children have a fever, it's a little bit like they're exercising or going for a run, so they can become dehydrated quite easily. So make sure they're keeping up the fluid and also getting some rest. It's common for children to feel exhausted when they have a fever. As adults, you might have experienced a fever that you can remember yourself, and it can be really quite tiring. Even as the body temperature is coming down, it's often important for a child to get some rest.